Now students, we will discuss that what is difference between bacteriostatic and bactericidal agents. So the name represents bacteriostatic. Static means to arrest. So bacteriostatic agents are those agents which will arrest the growth and the replication of the bacteria at serum level. Now, these are the agents that actually limits the spread of the infections. So now they have limited the growth, they have limited the replication of the bacteria. Now it's the step or it's the stage where your immune system will participate, your immune cells will attack those external agents. So we have already discussed that we have neutrophils, we have macrophages, which are the immune cells, which are the agents which have ability to phagocytose these external agents. Now, then, what are bactericidal agents? Cidal means kill. So these are the agents which kills the bacteria. So the bactericidal drugs, the drugs which kill the bacteria. So in case of immunocompromised patients, those patients whose immune system is not good, who have weak immune system, for example, in HIV patients. So in those patients, you will prefer bactericidal drugs. So while in those patients whose immune system is strong, you can use bacteriostatic drugs. So this is the graph which is representing, this black line is actually representing that the number of bacteria are increasing. We don't have used any drug. While in case of this blue line, this is representing that you have used a bacteriostatic agent, that is you have used chloramphenicol, and by using chloramphenicol, the number of bacteria has been reduced. Now this is at static position. Now at this stage, your immune system will tackle these agents. Now, this red line is representing that you are using bactericidal agent, that is you are using penicillin, and you have now killed the bacteria, you have reduced the viable bacteria. So, a drug can act as bactericidal as well as bacteriostatic agent. For example, we have linezolid, which is an antibiotic which acts as a bacteriostatic agent against Staphylococcus aureus and Enterococci. We have pneumoni, we have Streptococcus pneumoniae, for which the linezolid acts as a bactericidal agent. So now, what is minimum inhibitory concentration and what is minimum bactericidal concentration? To understand this, look at these figures. We have different test tubes containing the bacteria. Now, we have introduced antibiotics in it. In the first test tube, we have 64% antibiotic, then 32, 16, 8, 4, 2, 1, and 0.5%. Now, you can see that in tube where you have used 2% antibiotic, there is no bacteria. So this is the concentration, this is the minimum inhibitory concentration which has inhibited the bacterial growth. So we will call it as MIC. So now in the next figure, figure number 3, in first 2 test tubes, you can't see any bacteria. So while in from 16 to 0.5, there are red dots, it means they are having the bacteria. So now what is MBC? Minimum bactericidal concentration is the lowest concentration of the antibiotic or the lowest concentration of the medicine that kills 99.9% of the bacteria. No doubt in 64% you can't see any bacteria, but this is not the minimum concentration. This is the highest concentration which is killing the bacteria, and we need the minimum concentration which can kill 99.9% of the bacteria. And here in this diagram, this is the tube which is containing 32% of the antibiotic. So what is another name of minimum bactericidal concentration? And other name of minimum bactericidal concentration is minimum lethal concentration. So students, these were the 4 basic definitions which we will repeatedly use in chemotherapy.